Hello and welcome. I'm Amy McEntee, Chief Medical Officer at Salud para la Gente, and we are here with partners to talk about our response to the pandemic and why partnerships were so important. Today we have with us UC Santa Cruz, Santa Cruz Community Ventures, Santa Cruz Public Health, and Pajaro Valley Prevention and Student Assistance. Salud para la Gente is a federally qualified health center in Watsonville, California. We're in the south part of Santa Cruz County. The county represents only 29% of the population, but it had 57% of all the cases of COVID in the county. Salud para la Gente's main focus has been on serving farm workers in the community. We have about 28,000 patients, and like many other FQHCs across the nation, expanded our services during the pandemic to meet the needs of the community. We expanded to include testing, an outdoor respiratory clinic. We developed a contact investigation and tracing department, and we used monoclonal antibodies to help treat patients with COVID. And we also had supporting services for our patients. During this time, we tested 11,000 patients, and we had just over 3,000 patients who tested positive that we then worked to provide services for. Like many others, we faced a lot of challenges, initially with testing, then capacity to contact, trace, and investigate, then helping our patients deal with financial strain, and being able to reach hard to reach communities. We found that working in partnership was really important to overcome these challenges. We are a clinic that's always been focused on social determinants of health and health equity for quite some time. The COVID pandemic acutely demonstrated the immediate and severe impact social determinants of health can have on a community, and our response included keeping equity at the forefront. To accomplish this, that meant meaningful partnerships and changing the way our longstanding partnerships worked. It meant moving from a clinic-centric community partnership to a nimble partnership that was changing the mix of leading, following, and working alongside. And this is what helped to get our community what they needed. And today we'll focus on how those partnerships worked. To start, we have Isabel Bjork from UC Santa Cruz.
Thank you so much, Amy. My name is Isabel Bjork, as noted. I'm the executive director of the Genomics Institute here at UC Santa Cruz. I was also one of the founders of our COVID testing lab, which started up testing on May 1st. And I'm here really to talk about that process of starting the lab, but really the engagement of UC Santa Cruz and all of the community clinics that we served, the community that we served, to really make this effective for the community. So UC Santa Cruz is part of the UC system, and we're a research university. We don't have a medical school. What does stand UC Santa Cruz apart from other research universities is that although we are a leading research university, we focus deeply on social mobility and student success. And so we have repeatedly been ranked highly in both of those, which is actually very unusual for a university. And so that commitment to the community is the foundation of what helped us get where we are today, working on COVID testing and now virus sequencing. So our lab started on May 1st, as I noted, during the pandemic. It's now run over 100,000 tests. And so that tells you how quickly we went from 0 to over 100,000. There's no way we could have done this without the partnerships with organizations that in the community. And that includes the community clinics like Salud para la Gente. It also includes Santa Cruz Community Health, which was the first community clinic we worked with. There are other organizations that we also serve in the community, and we chose those based on the impact to the community. So an example of that is probation, which services juvenile hall, the jail. We worked with the rapid response team in public health. But we couldn't have done this if we hadn't learned a tremendous amount about what the community needs were. Early in the pandemic, we were concerned first and foremost with the limited testing capacity faced across our nation and definitely reflected in our community. We knew that without quick, reliable, and accessible testing capacity, our community would be heavily impacted. We collectively wanted to help, and that means staff, students, researchers, and campus leadership. We sought to help using the expertise that we had, which was in academic research, in RNA and genomics, in basic science, and in translational research, which essentially that last means working on research that is actually brought to the clinic. And we did that in pediatric genomics. Our goal was to bring that expertise to COVID. So we already knew a great deal about what it meant to work with hospitals and medical organizations, but what we didn't know was how to engage in a community response. We asked a lot of questions. We were guided by the needs of our community and the professionals who worked closely with community members and who had worked mindfully with patients. We did it through constant conversation and learning. And as just one example, one of our professors, Elena Vasky, spent the first months of our lab operation as we built our staff calling medical providers every single day to provide results. And that's because we made a commitment to provide results in 24 to 48 hours to all that we served. And so she was on the phone day in, day out, every evening, reporting until we built the lab sufficiently to gain the staff to assist. The key was to find a network that could offer different skills: public health policy and authority, philanthropy, funding, rapid laboratory service, and culturally sensitive medical care. Over the course of the pandemic, these partnerships allowed us to work in innovative ways to address the clinical needs and social determinants of health in our community. They allowed us to bring high-level care to the community in order to address the pandemic. And as a result of these partnerships, we were able to have reliable testing with fast turnaround. So 1 to 2 days, again, as compared to 8 to 11 in commercial labs. Effective contact tracing run by our community clinics in concert with public authorities on information provided by our lab. And so with that, I look forward to you learning more. I thank you for listening to our story about community health and success in the time of COVID in Santa Cruz County. I'd like to turn it over to Santa Cruz Public Health, to Jen Herrera in particular, who's Chief of Public Health at the County of Santa Cruz. Thank you.
Great, thank you. Yes, I am Jen Herrera, Chief of Public Health for Santa Cruz County Public Health. And I'm here to talk about why partnership was so important for the COVID-19 response. If you recall, as clinicians, there was a moment where public health really was the gatekeeper for all testing, for all case investigation, contact tracing, and it quickly became outside of our capacity to be able to maintain that level of response on our own. Also, as a health department, really our goal is to look at, to serve populations and really with a center of health equity, or towards achieving health equity. And something as big as health equity is something that we really can't do as a health department on our own. A health department really is an arm of the state to enact certain legal obligations for population health, such as tuberculosis control, case investigation, contact tracing, outbreak and disease management, maternal, child, adolescent health. There's some really specific things we do as a public health department. And then there's public health as a concept, which is really something that everyone who has a hand in providing wellness to the community is part of. And so during the pandemic, there's definitely a need to go beyond what we typically have control over in public health, and to reach out to our partners in order to best serve the community, and really for the sake of equity, to really ensure that the disparities that we were seeing that were growing, especially in the South County region of our community, we'd be able to address it. Where we really benefit here in Santa Cruz County is having a pretty strong health equity-minded health department, as well as county infrastructure and our board of supervisors. And so they really allowed us to do some things that were kind of novel, such as the collaborations with FQHCs and UCSC and our community-based organizations. We were in a position where we were able to utilize some of our resources to strengthen the collaborations in towards the goal of achieving health equity through the COVID response. And what we did as a health department was we developed a framework to help create a sense of collective impact in our community of what are we actually achieving? And so we created this framework called Save Lives, Santa Cruz County, where save lives, that is the ultimate goal of what we're trying to achieve with our COVID response, and SAVE is an acronym for the objective to cut us towards those goals. S meaning slowing the spread of COVID, A, adapting to new normal, V, vaccines and therapeutics, and E, elevating public health. Something we found is that, again, public health as a concept is that we didn't have to do this work alone. So we're so used to doing case investigation, contact tracing, figuring out testing on our own. And all of a sudden we were in a position where we had partners such as Salud and community-based organizations and UCSD reaching out to us and asking how they could be part of this response. And so a big lesson that we learned is, as a health department, again, we don't have to do this alone. It just kind of woke us up to think about how could we do this differently. And thinking about health equity, really to tackle something like health equity, you have to look broadly beyond the walls of a medical office. And to take that saying from the California Endowment, health doesn't happen in a doctor's office. It happens in parks. It happens where we have social mobility. It happens where we can address things like getting rid of poverty and homelessness and discrimination. And so that's where we had this shift, thinking about, we don't have to do this alone, and let's think upstream. While we're addressing CICT, or case investigation and contact tracing, while we're expanding testing, let's also think about how do we also partner with our community-based organizations for upstream approaches towards addressing poverty and making sure that at the end of the day, we can try to achieve our vision as a public health department. Our vision is better health every day for everyone. And so what can we do centered around that goal, centered around health equity? What can we do with this pandemic response to achieve that vision? And I think I will end there, and thank you for your time.
Thank you, Jen. Next, we wanted to go to Jeremy Sanford from UC Santa Cruz. As many people experienced during the pandemic, early on, it was hard to get testing, which was critical to contact tracing and investigation and to stop the spread of COVID in the community. We were very fortunate in Santa Cruz County to have a partnership with UC Santa Cruz, and Jeremy's going to explain how that worked.
Great. It's really fantastic to be here. We recognized early on at UC Santa Cruz that there was definitely a paucity of testing in our county, and that this was going to be a major barrier. And so by as early as May 1st, we had stood up the UCSC, what's now called the Culligan Clinical Diagnostic Lab. And we had this mission, which was to help our community by providing high capacity, quick turnaround time, gold standard COVID testing to the population in Santa Cruz that needs the testing the most. This effort was really one of the most amazing collaborations that I've had on our campus. It involved a diverse array of people in terms of their backgrounds, both in terms of academics and expertise. It involved work with administrators from all over the campus, most particularly the work with Michael Stone, who's a biochemist, and Elena Vasky, who's a molecular geneticist that studies pediatric oncology and has clinical diagnostic expertise, and as well as our great colleague Isabel, who was able to really work almost all of the important channels for us to make these partnerships with public health and Salud and other safety net healthcare providers. And we were supported by several other important administrators in the Office of Research, as well as Marm Kilpatrick, who is an infectious disease expert in our Department of Ecology and Evolutionary Biology. So we had this, we sort of realized there was a few keys that we needed to achieve, or problems that we needed to overcome if we were going to effectively set up a COVID-19 testing lab and importantly to scale it to really high throughput. And these are sort of the 6 key areas that we identified as being barriers, and the first, or opportunities, I guess, depending on how you look at it. The first was that we knew we had to come up with a very cost-effective and very rapid test, and we had to completely avoid supply chain bottlenecks. It was pretty well documented early on in the pandemic that there were problems with reagents, there was problems with authorized tests, and not having enough of pretty much anything, from swabs to the reagents needed to run the tests, to even some of the plastics, and some of that still continues. But like I said, because we're leaders and experts in RNA molecular biology, we had alternatives that we could apply to this problem. We also knew that we wanted to run the gold standard molecular test. In this case, it's an RT-qPCR test, which measures the viral nucleic acid. And this is critical because it's not only can be fast, but it's also very sensitive. Perhaps most importantly, we wanted to come up with a very simple sample collection approach where it didn't require tremendous amounts of PPE and could be effectively done en masse. One of the biggest barriers was moving away from paper-based test requisition forms, paper-based reports. We didn't want to deal with faxes. We wanted to have an automated system for sample accessioning and sample reporting. And in the same method that we wanted to move away from a sort of hands-free accession and reporting, we also wanted to move away from sample processing that was done by people. So we were very interested in applying the latest sort of standards in laboratory automation. And then the last big thing, which has been important for not just for our community, but more importantly probably for our campus, is to increase our testing capacity by running a pooled sample test. And what this does is enables us to run 10 samples at a time and report those results out quickly. So we pool 10 samples together and test them. This winds up helping us save reagents, and all of our testing budgets can go a lot farther. And this, therefore has an impact on the community. One of the amazing partnerships that we stumbled upon early on, perhaps maybe the very first week that we were in the lab trying to set up our test, was a really unexpected collaboration with the founder of Joby Aviation, JoBen Bjork. I quickly learned that prior to building these amazing flying electric vehicles, that JoBen had built a robot called, or a robotics company for laboratory research called Velocity 11. And when he heard that we were setting up a test, he called me up and asked me all the standard questions: which test are you going to run and what's your capacity? And when I told him that we bought this robot from a company called Agilent, it's called a Bravo, it's shown here, he said, "Oh, that's my robot. I built that." And I kind of scratched my head, and he said, "I want to come to the lab and work with you and help you set this up." And he became a key player in helping us set up the automation system that we needed to make this sort of 45-minute RNA extraction. And the reason this robot is so cool is because it can process 96 samples at a time, and that was a key way to accelerate our testing. One of the other ideas that JoBen brought to us, he's full of incredible ideas, as you can imagine, is the idea of trying to move away from the standard sort of sample collection tubes. And so for us, it was really critical to move to these 1.5 mil 2D barcoded tubes. And so these sample collection tubes have a barcode on the bottom and a barcode on the side that is totally machine readable. There's no human readable or legible labels that are going onto these tubes. At the site where a sample is collected, a clinician scans the barcode, they enter the information for the patient, and that creates an electronic test requisition form. When the samples are returned to our lab, they come in these racks of 96. There are 8 rows and 12 columns, and that 8 by 12 array fits perfectly with a robotics pipetting head. So it processes all 96 samples simultaneously. When the samples arrive in the lab, our platform basically scans and reads all the barcodes on the bottom of the tubes, matches them with the test requisition forms, and tracks all of that information throughout the extraction and testing process. And what we wound up with, this is a photograph, some photographs from our lab, are a really incredibly robust and high throughput COVID testing laboratory. Right here is one of our technicians accessioning 100 patient samples. It took probably 5 minutes to do. The samples are loaded onto a flatbed scanner, scanned, uploaded into the LIMS, and if there's missing information, the sample is removed and reaccessioned. Typically, that doesn't happen. We have brand new laboratory space that the university created in record time that's is full of these instruments, these Agilent Bravo instruments, as well as some other qPCR systems. Overall, these innovations have allowed us to rapidly scale COVID testing for the campus and for the community. And what you see in this plot here is the number of cases or tests that we performed each day. You can see back in July or June when we were doing most of this testing by hand, before we had moved to the small tubes and had implemented our LIMS and automated accessioning and reporting. And you can see that as we brought on the new tubes in September, you can see our numbers went up, and as the automatic accessioning and reporting came in line, we were able to dramatically increase our testing. And from about January on campus, we were running our pool tests. So some of these numbers you can imagine we were able to test 1,000 samples in the time that it would normally take us to test 100. So it was really phenomenal work. Overall, I think this has been an incredible partnership and an incredibly impactful. The Culligan Clinical Diagnostic Laboratory has run this is the latest information from our dashboard. We've run almost 120,000 tests since May 1st. 88,000 of these have been performed for our campus community, and over 30,000 or maybe 40,000 have been run for the broader community. On campus, we've kept transmission low, it's basically to nil. And in our community, we've identified probably over 3,000 positive cases, all of which we returned results to our providers and to the county in less than 24 hours. So we imagine that we played an important role in helping to limit transmission chains both in the campus and on the community. And yeah, it's been wonderful to work on something with groups that are really trying to make a difference and help the community recover. So thanks very much.
Thank you, Jeremy. For us at Salud, we really enjoyed working with the university. It was exciting to get to learn about the testing process early on and to have a relationship with the lab. It was really nice as we were testing to know that the people reading the test were just as vested in our patients as we were. And I oftentimes said, I don't know if the community realized it was just a handful of people that were really doing a large volume of tests for the entire community, and they were just incredibly dedicated. Another part of our response had to do with how do we even get people to want to come in to test if it might mean that they're going to be out of work, they're not going to be able to pay their bills if they're not able to work because they're on isolation or on quarantine. And a big part of our response to that had to do with working with Maria Cadenas, the executive director and president of Santa Cruz Community Ventures, in partnership with Salud and other community organizations to help meet the financial needs in the community. So next we have Maria Cadenas and Anita Aguirre, the deputy director at Salud, to talk about how they responded to that.
Thank you. Again, my name is Maria Cadenas. Pronouns are ella and she, and I'm the executive director of Santa Cruz Community Ventures. And since 1989, Ventures has worked to build a compassionate and equitable local economy that contributes to the region's well-being. And well-being to us is critical, and that includes the health and wealth connection. And I share that because the partnerships that we were able to do during COVID and throughout this time were only possible because we saw the connection of health going into the issues of poverty and equity that our community faces. At the core of the work at Ventures, we help families understand and use their economic power to create thriving communities where zip code, gender, race, immigration status, or age do not dictate income or wealth, We believe strongly that our work should be by and for the community we serve. As someone that moved to the US when I was 11 years old, and as a first generation college graduate, the work that we do at Ventures is very personal to me. I'm proud of what I have accomplished in my life, but I also recognize the blessing, gifts, and sheer luck that made it possible. And I believe that living well and being healthy should not be a result of luck. It is an expectation of everybody's ability to live and thrive, just out of human dignity and potential. The work that we did under Undocufund really laid the ground on issues that how we looked at the frame of the work. We worked in ways that remove system-level barriers towards economic equity. We provide leadership development and financial education for children and youth, including their families. And we lift and leverage the work already being done. We know that there are constructive, community-driven approaches that can transform current extractive structures that build our economy. And quite frankly, one of those clear expressions was the launch of an effort called Undocufund Monterey Bay. We launched this project and made it possible within 2 weeks. It was in recognition that we knew our community, and we knew our community had a large representation of undocumented workers, about 92,000 in the Monterey Bay region. We knew that because of their immigration status, they would not be eligible for any of the relief efforts being that at the federal government or the state government at the time. We knew that they didn't qualify for wage replacement programs within the current state safety net structures. We also knew that they were unbanked, low income, in industries that were heavily impacted by COVID, including tourism, services, and agriculture. And so we banded together. It took one call from one partner to say, we can do this. And then swiftly, leaning on the relationships that we have built over the years, we launched a partnership of over 10 organizations, all led by people of color, who had a large footprint in communities that we cared about, to quickly turn around and fundraise to support our community. It was more than relief aid. It was really about being present for our neighbors, giving them the dignity that they deserve, recognizing the asset that they brought to the table, so that they informed and led how we structured this program. So for example, we made sure that we gave as close to cash as we could without restrictions, whether they used it for rent or whether they used it for food or utilities. The recognition was that these families knew what they needed the most, and they needed the liberty to know how they were going to use the funds on their own. They didn't need that direction from us. So we had to trust people that they knew what was best for them. And so we structured Undocufund on that very premise. Undocufund really worked across 3 counties, Santa Cruz, Monterey, and San Benito. But it wouldn't be possible without partnerships with groups like Salud para la Gente, who shared those visions of connection, of health and wealth, and how important it was for people to thrive to make it possible. We also joined advocacy efforts across the state to make sure that we advocated for policy change in the safety networks that led to additional state funding. To date, we've been able to distribute over almost $4 million to over 3,000 families who were in need of support. And we continue to innovate and shift the work to make sure that we look at models that include guaranteed income components to provide stability. One of the things that has most surprised me of Undocufund and the impact that we had is not just about the money, it's about the sense of safety, recognition, visibility that impacts the families. We continue to do case management by reaching out phone calls and texting campaigns and checking in on the families. And thanks to Salud and other health partners, we also connect them to food support and other resources in the community. But the biggest thing that we've seen has been actually the impact on health. Families are saying that they feel seen. We had one woman who used to have migraines, and thanks to the fund from Undocufund, was able to seek a doctor's visit and realize they were being caused simply by not having glasses. And it was just that simple change that can really change somebody's life going forward. We also saw the impact in just self-confidence. We have a farm worker woman who thought she would always be working in the field. And by connecting with us and being seen and heard, she expressed how she knew that she could have a choice and had support to move to different roles if she wanted to. I want to open it up to Anita to share a little bit about the work and partnership on how we executed, really thanks to Salud para la Gente and other partners like PBPSA, to use their case management team to ensure that we can reach large volumes of people really quickly. From 0 to 3,000 families is not an easy feat, and we couldn't have done it with the expertise and leaning into the knowledge and platforms that our health partners provided. Anita?
Thank you, Maria. So in the early days of the shutdown, we right away began calling patients that we were concerned about, people who were really at high risk for poor health outcomes due to their health conditions. They had diabetes, or they had high blood pressure, or they were obese. And we really shifted the focus of our community health services department and contacted nearly 5,000 patients to educate them about COVID, to make sure that they understood infection control, to make sure they understood about social distancing and the importance of masking, all those key messages that were so critical. And so we screened nearly 10,000 people for Undocufund and other cash aid programs during this time. As Maria said, as I said, whenever we had an opportunity to talk to a patient, we were really also looking to connect them to other community resources to address their needs. So such as we have a partnership, a medical legal partnership with the Watsonville Law Center. We have a food distribution site. There are other food distributions happening in the community. We would work to connect them for food scarcity issues, or to help them apply for CalFresh, and or help them apply for Medi-Cal or other benefits that they may be eligible for. One such patient that is very memorable to our team, she was behind on her rent. She was concerned about being evicted, but she was also pregnant and recently diagnosed with cancer. And she was really concerned about public charge rules and did not want to apply for anything that would impact her immigration status. And so with that medical legal partnership, we were able to refer her to get really trusted information. And after understanding, the impact, after understanding that she could qualify for benefits that would not jeopardize her immigration status, then we were able to help her qualify for emergency Medi-Cal. As a result of these conversations with patients, we have redesigned how we our patient intake form, and how we are asking questions and what questions we're asking, really trying to get at the root of their health issues, of their social determinants of health issues, so that we can connect them to the resources that they need. Also, just to say that we also heard firsthand how Undocufund allowed people to feel that they could afford to quarantine and isolate. That would help decrease the infection rates overall by them not reporting to work. And this was especially true when they were asymptomatic. So really just recognizing that that additional money gave them the freedom to be able to decrease our infection rates, and for them to stay safe, and for their families to stay safe. So thank you very much.
Thank you, Maria and Anita. That portion of our response to the pandemic was so important in order to make everything else possible. If we had had all the clinical work without that type of support for our patients, I don't think our clinical work would have been successful. Next, we have Erica Padilla Chavez, the Chief Executive Officer at Pajaro Valley Prevention and Student Assistance. She's going to talk about how she helped to co-chair coordinating all of the local nonprofits in our response to help get education and information out to the community.
My name is Erica Padilla Chavez, and I'm the CEO of Pajaro Valley Prevention and Student Assistance. For over 3 decades, our organization has been focused solely on improving the quality of life for the children and their families who attend schools in the Pajaro Valley. And early in the pandemic, when it became evident that we were going to be in this for the long haul, almost out of a combination of intuition and a long history of collaboration, it became very clear that we needed to create a space with Pajaro Valley leaders to engage in ongoing communication to better address the emerging needs of the individuals that our respective organizations served. And so we created the group known as the South County COVID Triage Group. And it meets and has been meeting every Friday since March of 2020, recognizing that this group was going to need some backbone support. My organization stepped up to provide that backbone support so that our group can meet and discuss the various needs of the individuals that our staff and our team members came into contact. Out of that formation of our group came a realization that there were other social determinants that were emerging in the work, such as the financial assistance work that Maria Cadenas and Anita spoke about earlier. And so it became very clear to us that we needed to create a work group structure to better organize and leverage our resources and our leadership. And out of that came the recognition of the wonderful work that our county public health department was implementing through the Save Lives effort. But in recognition that many members of our community speak Spanish or Mixteco, which is the language of individuals originating from Oaxaca, and we have a lot of members in our community that come from Oaxaca, we recognized that we needed to support and bolster their education to the community by supplementing public health education for community members who spoke Spanish or Mixteco. So our PV Save Lives, our Pajaro Valley Save Lives group was formed. And thank goodness for that work, because we've been able to impart over 15 months of public health education in different mediums and in different formats. I want to very quickly just speak to the importance of what has transpired in this collective work over the last 15 months. As I mentioned, we have a history of collaboration. However, this pandemic really taught us the importance of working in a collective fashion and to do so with intention. And over the course of the 15 months, we've done work around the advocacy areas that I mentioned earlier, but also we've coalesced around statewide advocacy on issues that matter. We've coalesced around advocacy at the local level, both with our city councils and our board of supervisors, around addressing issues such as housing and the eviction moratorium as an example. And we did that together. And so there's a power that I think comes with our collaborative effort, pooling its voice to collectively advocate for the needs of our community. Frankly, I don't see how we can revert to working the way we used to work pre-pandemic. And so it's been a wonderful journey to be able to support the leadership that has emerged from, or has always been there, but has really emerged from in a collective form in the last 15 months. And more recently, recognizing that the vaccine distribution also needed support, our group quickly pivoted to create a vaccination response team. Again, all of these organizations that span industry and government and CBOs, they all stepped up to say, we'll all take an appointment or a day and we will deploy our staff to help the public health department or agency and our health providers distribute the vaccine to our community. And we've been doing that for quite a few months, and we will continue to do so. So in summary, this collective way of addressing the needs of our community, I think has taught us how we can pull our leadership and skills and resources together to better meet the needs of the community. And I look forward to continuing to work in this way as we continue to work on addressing the root causes of the inequities that we knew were there before the pandemic and were only magnified during the pandemic. Thank you so much.
Thank you, Erica. We appreciated all the work that you did to help coordinate everybody and create the table where everybody could work together. Thank you everybody else for sharing what you did in response to the pandemic and working with Salud and with public health. As we look forward to coming out of the pandemic, these partnerships are going to be key as we look to address equity and keep equity at the forefront and look at health disparities. And some of the things that we've learned that have been really key about this is that it's important to look to partners outside of the clinic and outside of who we would traditionally look to work with. We had never worked with UC Santa Cruz in this way, and we had loose partnerships with others, but this allowed for a much deeper partnership and allowed us to get services and expertise from others, and letting those partners lead where they're the expert led to a greater benefit to the community and for all of us.
I'm grateful that we're able to speak about this collaborative approach to the pandemic response. You've heard what all these groups here have achieved and with these partnerships. And what we haven't told you in full detail is how difficult it's been. I know that everybody here who's spoken has spent hours consulting with others in this group and with other organizations and individuals critical to serving our community to consult about the best approach to take, what the issues are, building the relationships that need to be built. Importantly, because of this coordinated professional effort that built trust and demonstrated expertise from all angles, the Community Foundation was able to support these activities with funding. That's because donors came together and recognized the collaboration that this group had. And it's because we built trust with those donors and with public health. That funding allowed populations with no or limited private health insurance and with limited access to receive high quality care. This network that is now securely in place has become a model for our community, and I look forward to seeing this model work well outside of the COVID pandemic. On the foundation of this network now, from the work at UC Santa Cruz, we're able not only to do COVID testing, but also sequencing of the virus to look at the emergent variants from the UK, from Brazil, India, South Africa, and other places. And that's really so that we can give more information back to the community about what's happening here, to identify transmission patterns and variants. And our goal is to help contribute to policy, operations, and care for populations that have historically not received that kind of care, or at least a high quality care that is often given to private health insurance structures. We're also working closely on building information platforms needed for local and state public health to follow up quickly on sequencing information they receive. Not only is that important now, but it is a system that we are designing to respond to all pandemics for all pathogens in the future, should we need it. So in the event of another pandemic, we know that having these strong partnerships will be crucial in responding to future pandemics. And even in the absence of a pandemic, and we hope in the absence of a pandemic, we believe these partnerships will drive progress towards systemic change that leads with inclusion and integration. To achieve this, we need to continue to devote resources to coordination, organizational issues and logistics that are often forgotten, lead actions with informed consciousness of social determinants of health, target fundraising expertise, and integrate medical service with government and academic expertise. Again, we are grateful to all of you for letting us speak to this important work in Santa Cruz, and to really show our appreciation for our collective efforts together. Thank you.